Hi everybody, it's me, Dr. Kestler from Lorain County Community College, like my new mask. Today we're going to be talking about a few things. We're going to be talking about some good news and some cases that are rising around. So we've got a lot of stuff to cover, so let's get moving. My temperature is 95.5, which is 35.3 degrees centigrade. First of all, I'm going to start out with a designation that, in fact, COVID-19, SARS-CoV-2, can, in fact, become airborne, and which is the difference between airborne and droplet is one of basically gravity, and that means that we have to do a couple things here. Number one, we need masks. And number two, we need distance. Both of those work together. You know, I've been testing masks, and I do have a little bit more to report on that. I don't have the data with me today because I was busy yesterday in lab and didn't get through all of the taking pictures and things of it. But I'll explain a little bit of it. First of all, wearing a mask makes a big difference when you're talking. I did some sneezing, but talking, putting a mask on, even a lousy mask, can prevent transmission. It's all about amount of aerosols and containing microorganisms out into the world. So that is actually something that works. So the idea here is that when you combine social distance and masks together, you can do some real good. All right. So I also want to talk about over the weekend. So yeah, just to summarize that study, there's masks and distance tend to work. We're going to be needing to do this for some time, and I'll get into that a little bit later. I want to talk about something else that, we're all, sheltering in place, doing things, and people are always asking me, what can we do? How can we protect ourselves? And here is something that you really, I know I'm going to make a lot of enemies about this, but there is a cardiologist from Tufts University. I listened to him over the weekend on a podcast called Innovation Hub, and he was talking about COVID-19 and comorbidity, other things that play a role in COVID-19, SARS-CoV-2 infection. And he said that all of them pale in comparison to one thing, and that one thing that he was stressing is weight. I mean, he gave examples of, you look at places like South Korea and Japan in the United States. South Korea has a very good control, and everyone says that's because they had testing on board and they were doing testing very well. True, but Japan also has less mortality with this, less death with SARS-CoV-2, and the big difference there is the extent of obesity, being overweight. And it's a huge problem, this guy argues, throughout all the ages. So if you are a young person all the way to being an elderly person, elderly persons who are not overweight are going to do better. And I know I'm kind of speaking to myself here. There's a reason I'm not filming below my chest. Yes, I know I need to do better too. My wife and I are going to try to do better. And the argument they make is that you can even do simple things without losing the weight, but just change to eating good food. And we all have time to do more careful planning and careful cooking nowadays. This is a great time for the entire country to get on board with doing something really good, and that is to eat right. And we got a little bit extra time, so eat right, eat the right portions, think about what you're eating. And it's a good time to get ourselves in great shape and protect us from the disease as well. So the title of this the podcast was A Tale of Two Pandemics, and one was the obesity pandemic, and the other one was the COVID-19 pandemic, and they're feeding on each other. All right. It certainly can't hurt you if you get in shape and lose weight and do all those good things. Now let's talk a little bit about some of the cases around the world. We heard last week that there were cases of, and early this week, that there were new cases in China. That is certainly is true, and we also know that I see a little bit of a tail end of something going on in the United States cases, and it's mostly being driven by the South. We have places like South Carolina, Florida, Texas, and Arizona, which seem now to be driving the whole country in terms of number of cases, and you can see everywhere. You can see the red on this. They each added nearly 2,000 cases, to almost 2 to 3,000, almost nearly 3,000 cases for the past few days, and that trend is continuing. I also want to point out that this is an oddball kind of a story, and that is in India, we saw a tremendous amount of new cases of deaths, not new cases, new deaths. India, of course, has 1.3 billion people. So there are a lot of potential for a virus. Mostly the lockdown has been considered pretty good in India in controlling the epidemic. But, to see a spike like you see off to the side of this, off to the right-hand side of this graph, the spike is huge. Of course, we'll be watching for the next few days to see if that trend continues. And the last thing I want to talk about today is some real good news, and that is one of the things we learned when we were treating all those patients in hospitals was that the cytokine storm that you have is something that can be manipulated and controlled. And one of the simplest things in the world is corticosteroids. Corticosteroids are wonder drugs. Corticosteroids, when I'm talking to my students about corticosteroids, I say they stimulate your immune system and they suppress it. And you've got and both of those statements are true, by the way, depending on how, when, and where you use the corticosteroids. And so you can save a lot of patients by using these things. The great news is they're really cheap, and they work. And it's something that you can that we can think about. The key to corticosteroid use, to dexamethasone, prednisone, all that whole family, is to use them at the right moment. To use them when you can, when a person needs it, when they're at the height of the immune responses, the destructive immune responses. Ultimately, death from COVID-19 is due to our own immune responses, and if we can control that and make that better, then we can do some great stuff. All right, I'm going to leave it right there, and I just want to remind you all to be good to each other, to respect people, other people's safety. Wear that mask. The mask is there to help you and to help them. It is not just something you do for yourself. It's also something you do for others. Remember to be good to each other, and may you persist like a lentivirus. Thank you.